All right, I think the waiting room has started to slow down, so I'll keep an eye, but go ahead and get started so we have plenty of time. I'm Melina Danko. I'm the Assistant Director of Communications and Marketing here at the Center for Excellence in Disabilities. I'd like to thank you all for joining us today. I'm filling in for Dr. Cottrell, and she is off teaching today, so um, we wanted to make sure that we had a great discussion, and thank you all for joining us. So today we have Dr. Daniel Derbyshire, who is a research fellow in public health economics in the Department of Public Health and Sports Science at the University of Exeter. Did I pronounce that right? Exeter?
Yeah, Exeter, yeah.
Exeter
Yeah.
in England. So we're really appreciative that he is taking time out of his evening there to share his research and his work with us. Dr. Derbyshire is going to be sharing information on a systematic review that he did on employer-focused interventions targeting disability employment, where he examined the results from 71 papers that evaluated the effectiveness of a range of interventions. Dr. Derbyshire has been published and cited other articles on the importance of disability representation that address implicit bias in the workplace and nurses contrasting explicit and implicit attitudes towards people with disabilities, and over 30 additional research articles that have been published and cited on various other issues as a part of his work. So we're really appreciative to have him here today. And a few housekeeping things. This is our grand rounds, and this is part of our 2025-26 academic grand round series. So if you've missed any of them and you want to watch some on our archives, they're all archived on our website, and we have them monthly on this Tuesday. So for those of you that would like to receive continuing education certificates to turn in, please go ahead and put your name and affiliation in the chat, and make sure that everyone has muted their line, and use your camera where comfortable. Use the chat to raise your hand, or if you have a question, and we'll have a great conversation today. So with that, I'm going to stop sharing my screen and turn it over to you, Dr. Derbyshire.
Yeah, thank you very much for the nice introduction. So yeah, let me just get my slides up first and then I'll say a few words. Can you stop sharing, Melina?
I'm
I can still see you.
trying. It seems
Okay,
like
sorry.
I've got all kinds of things going on over here. Sorry about that.
No problem at all.
Still sharing?
I can still see it, yeah.
There we go.
So hopefully you should all see that now, and I'm just going to get you all back up on the screen. Yeah, so I've been working on disability and health for about 6 years now, since I joined the University of Exeter, across a few different research projects. And it was during the first of those research projects where we conducted this review that I'm going to present today. But yeah, I've also done work around, as Mina mentioned, around implicit bias towards people with disabilities, around job preferences of people with disabilities in terms of flexible working and things like that. One thing I will say before I jump in as well is just a small note on language. In the UK, the preferred term is disabled people, although I understand in America it's people with disabilities, so I may end up interchangeably using the two as I go through, basically, depending on where the research I'm talking about was conducted broadly speaking. So yeah, the idea behind this research was as part of a research project, like I said, that we were looking at how to support small to medium-sized businesses to employ more disabled people, given there are a number of unique challenges faced by them that are not present for larger businesses, in particular around resources, human resource departments, budgets for training, things like that. And we then became interested in, okay, well, what can we do to change employer behaviour with respect to disability employment? I know that there's a lot of research around the employee side, focusing on people with disabilities, rehabilitation, things like that. And so we wanted to look at the employer side and see what governments around the world have been doing to try and change employer behaviour. So one of the reasons that we wanted to do this is because we know that there's a large disability employment gap. In the UK, it's about 30%, the difference in employment rates between disabled people and non-disabled people. And one of the main drivers behind this is a wide range of employer misconceptions around people with disabilities. That includes things like the number of qualified people with disabilities, which in part stems from systemic barriers within the education system, as we can probably appreciate being in a university settings ourselves. Employers are also concerned about the job performance, the productivity, basically, of people with disabilities. They're worried that disabled people or people with disabilities will require costly job accommodations, even though we know that most job accommodations cost very little money, if any money at all. And they're also worried, it's one of the topics I'll come to later, around any potential consequences of terminating people with disabilities, especially with respect to anti-discrimination legislation, which is one of the first types of intervention I'll talk about as I go through. These are all taken from a paper by Bonaccio et al. In 2019, which kind of lays out these common employer misconceptions and then kind of presents the evidence about why they are misconceptions, basically. It's a really good paper. I'm happy to share a link for it if people want. So today what I'm going to be presenting is from a systematic review that was published last year, about 18 months ago, in Social Science and Medicine with a couple of co-authors, all from University of Exeter as well. Like I said, we were focused on employer-focused interventions. So we were interested in what governments were trying to do to change employer behaviour, basically. We got a Prisma diagram. I won't go into the details too much, but just to say that we ended up with these 71 studies that Melina mentioned in her introduction as well. And so I'm just going to give you a broad overview of 5 different types of intervention that we identified. I know there's 6 listed there, but the 6th is, there was only 2 papers that we just couldn't categorize anywhere else, basically. So we put them in another category, and I'm not going to talk about them today. So when we were starting to classify it, we started to see that there were these different types of interventions. The first is anti-discrimination legislation, a common feature of many national economies around the world, with respect to disability, but also with respect to many other things as well. We saw that there were a number of places that had quota systems around disability employment, so mandatory minimum employment levels for employing a certain proportion of the workforce as people with disabilities. We saw that there were places where it was mandatory for employers to offer their employees part-time sick leave. So people could take sick leave on a proportional basis. So it may be that they would take sick leave for a day a week or something like that, or multiple days a week, or truncate their hours in the day and only do half days, for example, or something like that. We also saw that there were places where it was mandatory for employers to offer their employees graded return to work. And this is where, instead of it being a kind of binary thing, you're either on sick leave or you're not, that you could kind of ramp up your return to work. So when you first return to work, you may come back for 1 day a week, and then a couple of weeks later, you start doing 2 days a week, and you work your way back up to working full time or part time if that's what you were doing before. And then the fifth one is wage subsidies. So in some countries, governments offer private firms a wage subsidy to employ people with disabilities. That's in part supposed to kind of mitigate some of those concerns that I raised around productivity, around costs of adjustments, things like that. So the first one I want to talk about then is anti-discrimination legislation. This was the bulk of the papers that we found, 44 of the 71 papers. The majority of those, I think about 30 or so, were focused on the USA context, on the Americans with Disabilities Act. And largely the evidence is that they're ineffective. They haven't made much, if any, difference to disability employment rates. This is consistent with evidence from the UK, from Ireland, although there's only a couple of papers in each of those cases, and Italy as well. On a couple of more promising aspects with respect to anti-discrimination legislation, there's a couple of pieces of evidence that where managers have knowledge of this anti-discrimination legislation and or positive attitudes towards it, that there were better outcomes. And so it could be that in part there's a lack of knowledge, but there also is a lot of fear, as I mentioned, in terms of the misconception around termination of disabled employees. Within there, though, there is a small section of literature which focuses specifically on the role of job accommodations. So in the UK and in the US and in many other countries that have this anti-discrimination legislation, there is this right to a job accommodation where you can alter the conditions of work in some way that kind of accommodates your particular impairment. And in cases where those were specifically being used, there was more positive evidence around the effectiveness of anti-discrimination legislation. So anti-discrimination legislation largely ineffective, but where specifically people were using the provisions around requesting job accommodations, there tended to be slightly more positive evidence, at least. The next one that I want to talk about is quota systems. So we identified 4 countries that had quota systems, which had been evaluated in 5 of the papers that we looked at. They are South Korea, France, Austria, and Japan. What we found here was that the effectiveness of the quota system was very dependent on the way in which the financial aspects were structured. What that means is that where private firms have got a mandatory quota for a number of disabled people that they're supposed to employ, where they are not meeting that, they would be imposed fines. And in France, for example, where this quota system was deemed to be ineffective, the idea was that paying the fine was simply seen as like a cost of doing business. So paying the fine to not hire your sufficient quota of disabled people was just seen as like an acceptable cost, basically, with respect to it. Whereas, for example, in Japan, what they found was that there was more of a kind of a social responsibility aspect to it, because what they found is that even though small firms were exempt from this quota, anyone employing less than like 250 people, they found that a lot of those firms were still meeting what their quota would have been. And so they were still employing about the same proportion of disabled people as per the quota, even though they weren't actually tied by the quota. So the way in which the fines for non-compliance around quota systems were structured tended to be really important here. And that's why we saw positive impacts in Austria and Japan, but not in France and South Korea with respect to the implementation of quota systems. The next one that I wanted to talk about is this idea of part-time sick leave. Like I said, this is the idea that you can go on sick leave, but just for a particular proportion of your time. You could do half days, you could cut the number of days per week you do, for example. And this tended to be, well, it was entirely focused in Scandinavian countries, Finland, Denmark, Sweden, and Norway. And this was covering 7 of the papers that we looked at. This was really consistently shown to improve employment outcomes for people with disabilities, the availability of this part-time sick leave. And of course, in other places, good employers would offer this anyway, but in these countries it's mandatory, and that's why we kind of saw it as a intervention that we wanted to include. In particular, it led to more positive rates of successful return to work following long-term sickness absence, and it also reduced the amount of sickness absence as well. This was largely contained to people with physical impairments, so the evidence around people with mental health conditions benefiting from part-time sick leave was not as strong overall. And so we found that it tended to be focused on people with physical impairments that were benefiting from this through this ability to kind of reduce their hours. The next one I wanted to focus on was this idea of graded return to work. So this tended to be kind of Northern European countries, Germany, Netherlands, Denmark, but also Canada. So again, similar to the part-time sick leave, because the two things are fairly similar in the way that they're structured in terms of this acknowledgement that avoiding this kind of binary, you're either in work full time or you're off work full time kind of aspect is beneficial. We found again strong evidence of positive impacts on employment outcomes for people, especially with physical impairments again. And again, the evidence is a bit more mixed for mental health conditions. So these 2 types of intervention around reduced hours and phased return tend to have stronger evidence for people with physical impairments. The idea being that you kind of, instead of experiencing this kind of shock of a full-time return instantly on day 1, you kind of ease your way back into the responsibilities of your job. And that tended to really benefit people with physical impairments. The final one that I wanted to discuss is around wage subsidies. We found 5 countries, I think this is the last one, that offered wage subsidies. There were Spain, Australia, Belgium, Switzerland, and then Poland is the 5th one, covering 6 of the papers that we looked at. Here is a fairly similar story to the quota systems in the sense that the evidence is quite mixed, and the reason for it being mixed is dependent on the way in which the financial incentives are structured. So typically what they would do is they would offer to subsidize a particular proportion of a person's wage and do that for a specific amount of time. So they may pay 50% of the wages for 6 months, for example, and then after that, nothing. We found that this kind of system was impactful and had a positive impact in Spain and in Poland, but there was negative impacts. This actually had a negative impact on the rates of employment for people with disabilities in Belgium and Switzerland. And the authors of those papers suggest that the existence of the subsidy had a kind of a negative signalling value. So the idea that they were suggesting is that because the government was saying we'll subsidize wages for disabled people, that kind of enhanced the employer concerns about people with disabilities having lower productivity, for example, because it kind of puts in your idea, they said, okay, well, why do you need to subsidize the wages? There must be something wrong with these potential employees. And so it had a negative impact there. So the existence of the subsidy actually didn't work and actually had an adverse effect on employment outcomes for people with disabilities. Beyond that, there's also concerns around the longer term effects, in the sense that you get this kind of cliff edge where once the subsidy ends, the sustained long-term employment of people with disabilities was not seen as particularly effective. So just to give a couple of conclusions, because I'd love to hear what you all think as well. The part-time sick leave and the graded return to work, they were consistently seen as being effective interventions within the literature, with the caveat that that's mostly for people with physical impairments. The anti-discrimination legislation can be effective, in particular when people are using the provision around the right to request job accommodations. And that quota systems and wage subsidies, they have to be really carefully designed with respect to the economic incentives. Otherwise, they can really have unintended consequences and actually adverse effects. As in the case of France, where the fines for not meeting the quota were just seen as a cost of doing business, as in somewhere like Switzerland and Belgium, where actually the existence of a wage subsidy had a negative signalling value. And so that's kind of a broad overview of what we did and what we found. Like I say, I'd love to really have a discussion around this. So really happy to take questions or just hear comments in general. To be honest, it doesn't have to be a question. Thank you.
Thank you for sharing that. I have a few questions, but I wanted to open it up first to see if anyone else had any thoughts or questions or comments. I know that we have a few people here who have a lot more expertise in employment than I do. But I was curious too. I know that there are employment subsidies in the United States, and I was wondering if anyone who's on the call today could share some information about what those are so that we could have that discussion as well. Dr. Derbyshire, I had a question related. So my background is communications and marketing and developing translational products as a result of research to help then address some of the things that are found in the research. And so I was curious if you came across anything that had been created that was effective in addressing some of the misconceptions that employers had.
So a couple of the research, I'll just stop sharing the screen actually so we can see something better. A couple of the projects that I've worked on have kind of been focused around that aspect of how to speak to employers. I think that we did produce some kind of resources, one pager kind of things, little things like that. I think that from my experience of talking to businesses, because we did do a lot of webinars with businesses, especially small businesses as well, people like that, human resource managers. From my experience, it tends to be making the business case that is the most effective, highlighting the economic benefits that come from having a more diverse workforce, for example, and just trying to counter those narratives from a business case. So, for example, a lot of employers assume that if you're going to hire a person with disabilities, that suddenly you need to have lots of expensive adjustments made to your workspace, and just highlighting the fact that that isn't the case, because we know that the majority of job accommodations are actually really cheap things, or things that are even just completely free. And so I think that that's what I had found to be most effective, was highlighting the benefits from having a more diverse workforce, and in particular then as well, that speaks to the idea of retaining people as well. So keeping people who are in work healthy as well, because of the costs of hiring new staff, training new staff, etc. And so it was kind of trying to make the case that actually there's a lot of economic benefits that come from it as well. I think that if you're trying to appeal to more of a kind of hearts and minds argument, that you're probably often just preaching to the converted, and it's kind of reaching those more skeptical employers that I think was most effectively done through the economic side of things, the business case effectively.
Great. And if you had examples of some of those resources, the one-pagers that you developed, I'd love to see them. And then we could also, if it was okay with you, add them to the page that's archiving this webinar so that others would be able to take a look and see if that's something that would be able to be adapted for their purposes.
Yeah, absolutely. I'm very happy to do that.
Wonderful. I did see Alice. Alice, thank you for your comment in the chat. Would you mind to share with us?
Sure. Hello. I'm Alice Almond. I'm the Employment Service Manager for our state voc rehab system, Division of Rehab here in West Virginia. We don't necessarily provide a subsidy, but we do. I have a team of employment specialists, and we try to make that business case with employers as well when we're trying to promote the hiring of individuals with disabilities throughout both for-profit, nonprofit businesses throughout the state. But one thing that we have found that is effective is talking to them about on-the-job training, and that is an employer reimbursement that we sort of model it as this can help you with reducing your training costs overall, your training budget, because we see a lot of what's the word? Turnover. We see a lot of turnover in the workforce now, and a lot of employers are putting up the cost for a lot of training over and over and over. And so we try to promote that OJT. And a lot of agencies have their version of an on-the-job training. So we try to be more specific about what that means for us, because employers may hear that from several different entities, like Workforce also has an on-the-job training. So ours is a limited number of hours that we can provide support, and we try to be really transparent and explain what that means up front so that they're not confused about the process, and that we have our employment specialists that are their point of contact, so they know that they have the support from the agency staff. And I think that is another really big sell, that we're not just setting them up in this program and then they're out there by themselves having to figure it out to get this reimbursement, and if they will ever get it. So we're able to do 100% wage reimbursement right now for a limited number of hours. And that, of course, changes from year to year with our financial status with the grants that we receive from both the state and federal level. But it does seem to be effective. So that's something that I feel like is one of our biggest aspects in helping connect with businesses and making that case for business.
Thank you.
Thanks for sharing, Alice. There was a scheme in the UK, but it hadn't been evaluated. It still hasn't, as far as I know. So it didn't come into the scope of our review. It's called Access to Work, and what it does is it provides reimbursements to companies for the cost of making adjustments, for the cost of making job accommodations. Well, actually, it's a bit broader than that, because it can help with like travel costs as well, for example, if people need to get taxis and things like that. But it does cover the employer side in terms of the cost of making reasonable adjustments. Like I say, it hasn't been evaluated, but anecdotally, at least from what we've heard, it does seem to make a big difference as well. It's not quite the same thing, but it kind of just reminded me of that.
Yeah, and I agree with you. I think that employers often are really intimidated by the thought of hiring someone with a disability because they associate dollar signs with that, accommodations that they just think are, enormous in cost. But we also try to talk to them about the low to no cost accommodations that really are what most people use in the workplace. We also promote a resource called JAN, or the Job Accommodation Network, and they have some fact sheets as well on their website that are free for folks to print and have access to. So we try to promote that as well, and do that in our employer education. Yep.
Yeah, and I think that's completely right, because I've spoke to people who the accommodation that they needed was for their desk to be near the toilet, for example, which doesn't require any cost. You just need to swap a few people around. Or there was someone who had a care worker come around in the morning to help them get up, get dressed, etc. So they couldn't actually start giving the public transport until 10 o'clock. And so it's like none of those things are going to cost the business money, but like you say, they assume that they're going to have to get lifts installed and ramps and all kinds of equipment, but actually the majority of accommodations are just about speaking to people and then figuring out what they need, and it's often not what you expect from an employer.
Thank you for sharing that, Alice. Cheyenne, I see another comment in the chat. Would you want to ask Dr. Derbyshire?
Sure, I can. Can you hear me okay?
Yeah.
Okay. So I put that I do agree with the idea of like easing back into work after being absent for a period of time, because that does, help limit the burnout and the overall fatigue. And I was wondering, do you think that this could be extended to those experiencing pregnancy, since recovering takes both a mental, emotional, and physical toll on the individuals? And do you think businesses would be willing to make that leap to accommodate a little bit more in that aspect?
So personally, I think that yes, it would. I don't see a reason why it couldn't be extended, and even beyond that, where that physical and or mental toll is sufficiently high, then at least under the UK law, that could pass over the threshold of being classified as a disability. But even where it isn't, I think that idea of graded return to work, for example, I think it's an inclusive measure to include anyway, because it may be that people, like you say, are pregnant, or they have other care responsibilities, for example, other things that mean that they need to take extended leaves of absence. And so that idea of a graded return to work, I think, at least in theory, could be beneficial for basically for everyone that kind of had to go through something like that and then would benefit from slowly returning to work. Yeah, absolutely.
Yeah, in those scenarios too, it's a good idea to ask your physician to put that in your return to work paperwork. That may be something that they don't do as a regular standard, but it never hurts to ask. And that way, if you have that in writing from the physician, that also allows the employer the ability to let you start to come back to work at a lower level, because sometimes it's just like the processes, right? Like we're not allowed to work if we're on medical leave. And then we have to come back from medical leave to be able to do any work. And so having, that middle ground or that graded may be something that if you asked the physician for, that would be, everyone would be open to it. They just never thought about it. So great question. Thank you.
And sorry, and I also do think on that point that It's again beneficial for the businesses because actually to get sustained return to work, the graded return to work is much better at doing that than this kind of binary thing where someone may return to work thinking that they're ready, but actually then 2-3 weeks later, they realize that it was too much to take on too soon. And so then they go off and leave again. And so you kind of get this fluctuation between leave and then return and leave. Whereas actually the graded return to work leads to much more sustained return to work, much more sustainable.
Good point. Good point. I have another follow-up question if no one else, I don't want to take it all. Well, I'll go ahead and ask it, and if anyone else has anything, just raise your hand or unmute. But I was curious, so often we see things from families who are having a hard time because they have to take off work to care for their child that has a disability or a complex medical condition. And then that, of course, can be covered under FMLA. But I was just curious if you came across in your lit reviews or any of your other research things that were helpful for families or for employers, promising practices, things like that.
It wasn't within the scope of the review, but it's definitely a concern for a lot of families, for example. I can't really say that I've seen anything particularly promising in that area. I do know that there's evidence that parents of children with disabilities, for example, also suffer worse economic outcomes. So even though they're not people with disabilities themselves, there is still kind of an employment discrimination there, as you kind of already alluded to. But no, not really seen anything in terms of particularly good practice in that area, unfortunately.
Well, maybe that could be a next step.
Yeah.
All right. Well, Michelle says this also extends to the older population. Yes, taking care off to care for aging parents. Yes, that's so true.
And that's just going to become an increasing concern over the coming years as well, I think.
Yes. Any other questions or points of conversation? All right. Well, thank you so much, Dr. Derbyshire. This was a great conversation. I'm going to go ahead and share my screen one more time, if I can do it this time, to bring up the evaluation. Okay. So thank you to everyone for joining us. If you wouldn't mind to take just a short minute to complete our evaluation and survey to provide us feedback on the webinar today and ideas for future ones, we'd really appreciate it. Those who request a certificate of attendance, please make sure that your email address is in the chat so that way we can get that to you within the next few days. I want to thank you, Dr. Derbyshire, for sharing your work with us and taking time out of your evening. I think it was good conversation, and I think that everyone here definitely learned some things and are going to take some ideas away with us.
Great. Thank you all for listening. Really appreciate it.
Yeah. All right. Well, thank you guys, everyone. You have a good rest of your day.